Hi everyone, I am Dr. Shashi Kant, consultant orthopedic and joint replacement surgeon. Let us know what is PRP and its role in knee arthritis. PRP is called as platelet-rich plasma. It is prepared from your own blood. We withdraw 20 ml of blood, centrifuge it to increase the density of platelets and prepare a platelet-rich solution. Normally platelet count in our blood is 2 to 4 lakhs. We increase the density to at least 1 billion. Then this PRP solution is injected into the knee under aseptic precautions. Once the platelets are inside the knee, they release growth factors to reduce inflammation and help in the healing. In various studies, PRP has shown good success in reducing the inflammation and improve the function up to 1 year follow-up. What are the side effects of PRP? Because it is prepared from your own blood, the complications are very rare. Does PRP help everyone? No. Lot of patients would not get any benefit from PRP. The patient should be chosen very carefully as PRP helps only in stage 1 and stage 2 arthritis. In stage 4 arthritis or bone-on-bone arthritis, PRP has no role. Knee replacement is the treatment of choice in stage 4 arthritis. PRP cannot replace it. Thank you.